Welcome to American Black Journal. I'm Stephen Henderson. The recent suicide of comedian Robin Williams, who suffered from severe depression, has placed the national spotlight on mental illness. Left untreated, mental illness can be disabling and even life-threatening. Although African Americans have traditionally been reluctant to discuss mental health issues, research shows it's a topic that needs to be addressed. For example, 1 out of every 4 adults will experience mental illness in any given year. Over 9 million people suffer from both mental health and addiction disorders. And nearly 5 million children have some type of serious mental illness. Joining me now is Joy Calloway, who's the president and CEO of New Center Community Services, a mental health agency in Detroit. Thanks for being here.
Thanks for having me.
Boy, those numbers are really shocking.
Startling.
Let's talk about why in the Black community this is something we don't talk about or that we're not comfortable talking about.
There is a community stigma across the country. It's our culture here in America to be strong, to man up, to woman up, and to not talk about our challenges. We've done a decent job on the healthcare side, starting to talk about heart disease and hypertension and obesity, but mental illness and the discussion of mental health is still stigmatized because it can be such a devastating thing, and it is something that we prefer to keep quiet.
Yeah.
The African American community is almost twice as challenged as the larger community with the man up, be strong, be a woman. We've come from a strong history of people, get over it, pray about it, don't talk about it. And so we really have to work on bursting through that piece.
Right, right. I would also imagine that part of the problem is identifying mental illness. I mean, I think a lot of people think, well, I'm just sad, or that person's just sad, they'll get over it, it'll pass. They don't really understand what the symptoms are of actual depression.
Absolutely. If you were, God forbid, to fall out and grab your chest and start to have a hard time breathing, we would know what was going on. I would run over, do what I can, get someone on the phone. We would know what to do. But if over time I'm noticing that as a colleague or friend of yours, you're starting to decompensate mentally or emotionally. First of all, not many people know how to recognize signs of changes in people's mental health status, number one. And then number two, because again of the stigma, Stephen, it's hard to say, you know, friend, I think you're having some challenges, let's go get some help. So we've got a number of things to do. We have to start talking about mental illness like any other chronic disease. We don't have a problem saying I'm hypertensive or I have diabetes or I have this or that, because we know there are resources out there to help. And people as a society don't judge folks if they have diabetes or those other things.
That's right.
Unfortunately, we tend as a community, as a society, we tend to judge people and think that you're just having a bad day, get over it, or you're not relying enough on your faith, especially in our community. You're not, talk to the Lord about it. We have to do a better job. Clearly, our faith walk is going to help us for those of us who believe, but God also created people who are experts in certain areas to help us out. So as soon as I would run to a heart specialist, if I start to decompensate emotionally or mentally, I need to go to talk to someone who went to school to help my brain.
Right. When you talk about depression, and particularly depression brought on by trauma, I think you automatically start to think about Black children, and think about Black children in the city. And how much they see and experience at a really young age. That you've got to have much more widespread mental illness and disorder among kids than I think most people would think.
Absolutely. A couple of things come to mind. Trauma is definitely a precursor for mental illness. We at New Center Community Services do serve children as part of our program offerings, and those children are seriously emotionally disturbed. And many of them, I dare say, the majority of them have experienced trauma at a young age. We know from studies years ago that trauma impacts your health long-term, physical health, and now we are realizing and accepting the fact that even more so, it impacts your mental health in a negative way.
I've read some research that talks about how trauma at an early age almost rewires your brain. Really just changes the way you react to everything.
And unfortunately in our communities here in Detroit and many other urban settings, you can go into a classroom and ask, how many of you know someone that's been shot, been killed, had some other major trauma? Most hands will go up in the urban setting. And then how many of you all witnessed it? that is a whole
Right.
nother level of
Seeing it,
trauma.
right.
To see that as a child, think about seeing something like that as an adult with years of experience and ways to cope behind you.
Sure.
As a child, you don't have the mechanism to cope to cope with those things. And so it starts to become internalized, and add to that parents, I'm a parent myself, we don't want our children labeled.
Right? No.
So when we should be going to say, I think there's something happening with my child, she needs some help, it's difficult for us to do that societally, but specifically in our community, because that's just not traditionally how we cope with things.
Right, right. Well, how do we deal with children? I mean, that's a very different kind of issue than adult
It
mental
is.
illness. I would think you need to deal with the schools, which
Absolutely.
of course are a challenge themselves in Detroit.
It's a multi-factorial kind of approach. One, we have to deal with parents. Many times, children of traumatized situations
Right.
are in traumatized situations because their parents are, and so we definitely have to reach out to the
can't
parents.
just deal with the kid,
You
you
can't.
gotta deal
You
with the
absolutely
family.
cannot. You absolutely cannot. So you have to deal with the family and deal with the trauma issue and deal with all the social economic determinants of health, of mental health with the family. You also have to deal with the schools, as you mentioned. We have to teach our educators and the social workers in schools, administrators, how to recognize symptoms of trauma. Sometimes the acting out of a child is not just because they're a bad kid,
Right.
but they are reacting to something that's happening in their home life.
Right.
And we slap a bad kid label, go to the principal's office. What we're challenging in the larger mental health community, and specifically at New Center, we're challenging administrators and teachers and social workers to give us the opportunity, when you're in a crisis situation, give us an opportunity to come in and help you all determine if it's a trauma-based situation.
Right.
And if it is, we have a program for that. We can help these kids turn the tide, because just because you've lived through trauma doesn't mean you have to continue to live with that trauma.
Right, right.
In addition to that, we have to go to those community organizations that support our families in the community. I'm going to say churches.
Sure.
I'm going to say our fraternities, our sororities, our community groups. All of those organizations and entities need to be educated on mental illness
How to
and mental
recognize
health,
it,
how to
how to deal
recognize
with
it, and what to do about it.
Yeah, yeah. One of the things I think people don't quite get is that mental illness is, I don't want to say curable, but
It is a
it's
manageable
something-
disease,
right.
if
it's
I may.
It's like
Diabetes,
right,
hypertension.
right.
It is a chronic disease. And one of the things that I think is important to fight the stigma is to force that issue. This is a organic brain issue. In most cases, some is trauma-induced that changes the chemistry of the brain.
Sure.
Some folks are born with the propensity to have it because of history. We have to help people understand it is a disease of the mind. I didn't choose it. I didn't choose my hypertension.
Right, right.
People don't choose to be schizophrenic. Would they do that if they could? And so we have to get away from the shame and the blame of it and recognize that it can be managed. The other piece of working through the stigma issue is to not just talk about mental illness. I want to talk about mental health.
Right,
Talk about
right.
the importance, just like we talk about drinking water and exercising and eating right. What are we doing to maintain our brain
Right.
as an organ? What are we doing to maintain our emotional life and maintain that? The last piece I would say around fighting stigma, and I think it's specifically important for children to hear and families to hear, there are people who are living with mental illness, some severe, that are enriching our lives every day.
Right.
I challenge people to think about what your life would have been like without the music of Michael Jackson.
Right, right.
Severe depression and anxiety.
Yeah.
What broadcasting would be like without Oprah Winfrey, who
Sure.
suffers from
Who
anxiety.
suffers from yeah.
Halle Berry, Herschel Walker. The list goes on and on.
Yeah.
People
It's
need
far
to
more
know.
common,
Far more
than-
common than we
than
want to
people
talk
think
about
it is.
because of the stigma.
Right.
But to break the stigma,
Right.
we have to talk about it.
Right. They made some decisions in this state about 20, 25 years ago about how we deal with mental illness that I think everybody regrets, including the people who made the decisions. That
Exactly.
it did not turn out
Exactly.
the way they thought. We don't spend a lot of time or money
We don't.
in this state trying to give people opportunity to deal with these problems.
That's absolutely right. I was a small child when they made those decisions. But I think that what we could do now, I don't want to talk about what should have happened. What we need to do now is to make sure that we have several options for dealing with mental illness.
Right.
I think the decision to close the state hospitals was, there were some challenges there and that need to be dealt with.
Right. They weren't working.
They weren't working either.
Right.
But to just shut them down and say, let's
And
totally
let
go to
everybody
community, that wasn't right either. We need to be more thoughtful. We need to be more strategic. We need to be more innovative about how to deal with mental illness. Realize it's not going anywhere.
Right.
It's not going anywhere.
Right.
And yet, if we treat properly with medication, with therapy, with group, with supported employment, supported housing, all these things that my organization, my peer organizations offer,
Right.
if we support an individual living with mental illness with all of these things, they can be successful, they can be productive, they can enrich our lives, like some of the people we just talked about.
Right.
It can be done.
Right. It can be
Managed.
dealt with. The governor has talked at least, in broad terms about wanting to do some different things. If you could make a list of 2 or 3 things, we've got about a minute left, 2 or 3 things that would make the biggest difference in terms of state policy dealing with this problem.
Oh, that is a fantastic question. And the first thing that comes to mind always is money, but I don't think it's necessarily money. We clearly need more dollars flowing through the community mental health system.
Right.
But I believe that we need to figure out how to make the discussion of mental health and mental illness part of educational curriculums, part of the physical health system, making sure, and we're already bringing substance abuse and substance use disorder into it, make it part of it. We just have to figure out how to make it something that we're talking about all the time.
Right, right.
And I think that would be the first step in dealing with this. We got to get it from behind the closet, behind the curtain, and make it less stigmatized, Stephen.
All right. Well, great to have you here.
Thank you. I appreciate being here.
Appreciate your work, obviously.
Thank you, sir.